Well, to be honest, I think a dentist is actually in the best position to do just that. I have been in clinical private practice seeing patients for almost 40 years. I've had a fellowship in nutritional and environmental medicine for over 20 years. I've been interested in stress and health and working on this stress model for almost all of that time. So when I look at a holistic approach to healthcare, I honestly believe only a dentist could really write something like this. And if you hadn't thought about it before, part of the book is really about, it's of interest rather to anybody with a mouth who's interested in their health and has never really connected the two. It's why I've incorporated dental stress into one of the 5 stresses that I discuss. Look, it's the start of the digestive tract. So if your teeth and your jaw joints aren't working properly, you're not really digesting your food properly either. It's also the gateway to the respiratory tract. So if your teeth are crowded or narrow jaws, or you had your wisdom teeth out or your teeth are all bunched up, it means your upper airway is also restricted as well. And if you think sleeping and breathing are important, the shape and size of your mouth are surprisingly important as well. You may not have considered it. It's also connected to how your own posture, how you breathe is affecting your posture. As well as that, but wait, there's more. As well as that, there's also the site of the 2 most common infections, and that is tooth decay and gum disease. And because of chronic inflammation, that means, do your gums bleed when you brush or floss? I think a lot of people will be putting up their hand there. But if they do, that tells us there's some chronic inflammation, and that's connected to every degenerative disease: heart disease, cancer, cardiovascular disease, diabetes, autoimmune diseases. So the connection between those 2 diseases and general health is profound. And because of tooth decay, we implant a lot of material into people's mouths. We want that material not to be toxic, to be compatible with good health, or as we say, biocompatible. It's an area that's really sensitive as well. So there is so much neurology in the oral cavity that if that is slightly out of balance, it can affect chronic pain throughout the body. So there's a great deal of reasons why only a dentist really could write something like I've written in A Life Less Stressed and include the 5 pillars of health and wellness, which actually includes many dental stresses.